Last talk, we established how to define and describe populations and disease distributions. Now we get into the biology. How does disease actually spread through populations? What determines whether an individual animal gets sick? What determines whether a pathogen can sustain itself in a population? These questions are answered by three foundational frameworks: the natural history of disease, the epidemiologic triad, and the chain and modes of transmission. These aren't just theoretical constructs. They're the biological logic that underlies every outbreak investigation, every control program, and every biosecurity protocol you'll ever work with. By the end of this talk, you'll be able to describe the stages of disease in an individual animal, explain how agent, host, and environment interact to produce disease in a population, and classify the major routes of transmission with veterinary examples for each. Let's get to it. The natural history of disease describes the progression of infection in an individual animal from first exposure through to final outcome. Understanding each stage and its duration is fundamental to controlling disease at the population level because each stage has different implications for transmission, detection, and intervention. The susceptible stage is the starting point. Animals without protective immunity who are at risk of becoming infected if exposed to the pathogen. Susceptibility is the foundation of your at-risk denominator in incidence calculations and in compartmental models. The exposed or incubation period begins when infection is established and ends when either clinical signs appear or the animal begins shedding pathogen, whichever comes first. During this period, the animal appears healthy and the infection is undetectable by clinical observation. Duration varies dramatically: minutes to hours for some toxins, days for most respiratory and enteric pathogen, weeks for some systemic infections, and years for prion diseases like BSE. The preclinical infectious stage is arguably the most epidemiologically important and the most dangerous. Animals in this stage are infected, replicating pathogen, and actively shedding to the environment or to herd mates, yet showing no clinical signs. This is why disease can spread widely through a population before a single case is recognized. PRRS in a naive breeding herd, SARS-CoV-2 in a mink farm, FMD in a cattle feedlot, all were spread substantially by preclinical infectious animals. Clinical disease is what clinicians and clients see, the visible tip of the iceberg. Depending on the pathogen and host, clinical disease may or may not coincide with peak shedding. The outcome stage determines where the animal goes next. Recovery with immunity removes the animal from the susceptible pool relevant to herd immunity calculations. Death removes the animal entirely, and the carrier state, particularly important in veterinary medicine, describes animals that recover clinically but continue to shed pathogen at lower levels, serving as a persistent reservoir for population transmission. Salmonella carriers in cattle, Campylobacter carriers in poultry, and FELV latently infected cats are all important veterinary examples. The epidemiologic triad is the conceptual model that explains why disease occurs or doesn't occur when a pathogen encounters a host. Disease requires the intersection of all three elements: a capable agent, a susceptible host, and an environment that facilitates their meeting. Remove or weaken any one element, and disease is reduced or prevented. The agent is characterized by several properties that determine its epidemiological behavior. Infectivity is the ability to establish infection, the minimum infectious dose, and how easily the pathogen penetrates host defenses. Pathogenicity is a proportion of infected animals that develop clinical disease. A highly pathogenic agent causes disease in most of those infected. A low pathogenicity agent may infect widely but cause disease in few. Virulence is the severity of disease in those who do develop it. A highly virulent pathogen causes severe, potentially fatal disease, and survivability determines how long the agent can persist in the environment and remain infectious. The host is characterized by intrinsic and acquired factors. Species susceptibility is fundamental. Pigs are not susceptible to bovine viral diarrhea virus. Within a susceptible species, breed, genetics, age, sex, nutritional status, immune competence, vaccination history, and stress level all determine whether infection leads to disease. The environment is the context that brings agent and host together or keeps them apart. Climate affects pathogen survival and vector populations. Housing density affects contact rates between infectious and susceptible animals. Ventilation affects airborne pathogen concentration. Biosecurity infrastructure determines whether pathogens can enter or leave a facility. The most important practical implication is that intervention can target any corner of the triangle. Vaccination strengthens the host. Disinfection and biosecurity reduce the agent. Improved ventilation, reduced stocking density, and vector control modify the environment. Effective disease control programs typically address multiple corners simultaneously. The chain of infection is a more detailed model of transmission than the triad. It sequences the steps that must all occur for a pathogen to successfully reach and infect a new host. There are 6 links in the chain, and control strategy is fundamentally about identifying which links can be broken most efficiently. Link 1, the infectious agent, the pathogen with the properties we discussed in the triad. Not all pathogens are equally transmissible or equally capable of establishing infection. Link 2, the reservoir, where the agent normally lives, multiplies, and from which it can be transmitted. Reservoirs may be animal, domestic or wildlife, environmental, soil, water, or human. Understanding the reservoir is critical for control. You can't eliminate a disease if you don't address its reservoir. The classic veterinary challenge. Wildlife reservoirs that sustain pathogens that periodically spill over into domestic animal populations, as with Mycobacterium bovis in badgers or deer, or brucellosis in elk. Link 3, portal of exit, how the agent leaves the reservoir, respiratory secretions, feces, urine, milk, blood, reproductive discharges. The portal of exit determines where environmental contamination occurs and guides sampling strategies in outbreak investigations. Link 4, mode of transmission, the subject of our next slide. This is the mechanism by which the agent travels from reservoir to new host. Link 5, portal of entry, where the agent enters the new host. The portal of entry often determines pathogenesis and clinical presentation. FMD virus entering through respiratory mucosa versus oral mucosa may differ in clinical expression. Some pathogens are highly specific about portal of entry, others are flexible. Link 6, susceptible host. Anything that increases host susceptibility, immunosuppression, malnutrition, stress, concurrent infection, effectively strengthens this link. Vaccination and good nutrition weaken it. Transmission describe how pathogens travel from their reservoir or infectious source to a new susceptible host. Understanding transmission mode is the foundation of biosecurity design, because you can't design effective barriers if you don't know what you're trying to block. Direct transmission requires physical proximity between the source and the new host. Direct contact, nose to nose, licking, mating, or nursing, is the most obvious form. Droplet spread involves large respiratory droplets that fall quickly to the ground within about a meter. Canine influenza is a good example. Vertical transmission passes a pathogen from dam to offspring, either in utero, during parturition, or through colostrum. EHV1, BVDV, FELV, and leptospirosis are all examples in veterinary medicine. Indirect transmission routes involve intermediaries. Fomites are inanimate objects contaminated with the pathogen. boots, needles, shared equipment, vehicles, feed bags. FMD virus can survive on fomites for days under cool, moist conditions, which is why decontamination of vehicles and personnel is a core FMD biosecurity measure. Airborne transmission involves small particles, aerosols less than 5 micrometers in diameter, that can remain suspended in air for extended periods and travel long distance. PRRS virus and avian influenza H5N1 are examples relevant to veterinary medicine. Vehicles, contaminated food, water, or milk are important for enteric pathogens. Vector-borne transmission is either biological, the pathogen replicates within the vector before being transmitted, as with EEE in mosquitoes or blue tongue in Culicoides midges, or mechanical. The vector physically carries the pathogen on its body without replication, as with flies transmitting pink eye bacteria. The dead-end host concept is important for biosecurity risk assessment. Horses infected with West Nile virus develop neurological disease, but cannot transmit the virus to mosquitoes or other animals. They're a dead-end host for transmission. Humans with EEE are similarly dead-end hosts. Knowing whether your species of concern is a dead-end host or a true reservoir host fundamentally changes the control strategy. Distinction between primary and secondary cases is fundamental to outbreak investigation and to understanding transmission dynamics. Primary cases are animals that were infected directly from the external source, the reservoir, the contaminated environment, or introduced infectious animal. They represent the point of entry of the pathogen into the previously naive population. Identifying primary cases tells you where the outbreak started and potentially how it entered, through purchased animals, through a contaminated feed source, through a wildlife interface. Secondary cases are animals infected within the population, not from the external source, but from the primary cases or from each other. The number and pattern of secondary cases tells you how efficiently the pathogen transmits within the herd once it's established. Are all secondary cases clustered around the primary cases, or have they spread diffusely? Are secondary cases appearing rapidly, suggesting efficient direct contact transmission, or slowly, suggesting lower contact rates or lower transmissibility? In our BVDV example, 3 animals arrived from an infected auction herd, primary cases. Over 4 weeks, 27 additional animals developed infection, secondary cases. This is a high within herd secondary case ratio, which is consistent with BVDV's ability to establish as a persistently virulent infection in a naive herd. The secondary attack rate, the proportion of initially susceptible contacts of primary cases that develop disease, is a measure of within population transmission efficiency. It's closely related to the basic reproduction number R0, which we'll cover in detail in Talk 6.3. High secondary attack rate means high R0. Low secondary attack rate means lower R0. And lower R0 means the pathogen is easier to contain once introduced. Here's the summary. Natural history progresses through susceptible, incubation, preclinical infectious, clinical, and outcome stages, with the preclinical infectious stage being the most important for population spread, because animals transmit before they can be detected clinically. The epidemiologic triad explains disease as the intersection of agent, host, and environment. Intervention targets any corner. The chain of infection has 6 links. Breaking any link interrupts transmission. Transmission is either direct, contact, droplet, vertical, or indirect, fomite, airborne, vehicle, or vector-borne. Biological vectors allow pathogen replication. Mechanical vectors carry pathogen without replication. Dead-end hosts can't sustain the chain of transmission, and primary cases identify the source. Secondary cases quantify within population spread. In the next talk, we build on these transmission concepts to cover the mathematical framework of infectious disease, compartmental models, the basic reproduction number R0, herd immunity, and vaccine efficacy versus effectiveness. Read the following scenario and take a stab at answering the questions on your own. Then we'll work through the answers to the questions together. Orf, contagious ecthyma, is a common and highly instructive veterinary example because it illustrates all 6 chain of infection links clearly, has a well-understood natural history, demonstrates the epidemiologic triad vividly with age-related susceptibility, and has a zoonotic dimension. Humans can be infected, but dogs are not susceptible, illustrating the host specificity concept. Question 1, chain of infection. Reservoir and portal of exit. The primary reservoir in this outbreak is almost certainly the 12 introduced animals from the other farm. Virus can persist in scabs shed from healing lesions for months to years in the environment. So the environment, contaminated bedding, fencing, feeding equipment, is also a secondary reservoir. Portal of exit. Infected animals shed virus in vesicular fluid and proliferating lesion material. The skin lesions themselves are the primary exit point. Scabs falling from healing lesions contaminate the environment. Mode of transmission. Virus is primarily transmitted by direct contact with active lesions and by indirect contact with contaminated fomites, scabs on fencing, feeders, bedding, and shared equipment. It can also be transmitted through abrasions or microtrauma to skin and mucous membranes during nursing, fighting, or rough contact with contaminated surfaces. This is an indirect fomite contact transmission route. Portal of entry. Small abrasions, cuts, or microtrauma to the skin and mucous membranes of the lips, muzzle, and oral cavity, the same areas where lesions develop. Intact skin is a relatively effective barrier, but the normal trauma of nursing for kids and competition at feeders provides multiple portals of entry. Most amenable intervention. Removing and isolating clinical cases, breaking the infectious agent to susceptible host link by reducing contact with shedding animals, decontaminating shared equipment and bedding, breaking the reservoir fomite link, and preventing new introductions without quarantine, breaking the reservoir to new herd link going forward. A live attenuated or vaccine is also available in some countries and would strengthen the susceptible host link. Question 2. Natural history stage of introduced animals. The 12 introduced animals were most likely in the incubation period, or possibly the preclinical infectious stage, when they arrived. Orf has an incubation period of approximately 3 to 8 days. If the animals appeared clinically normal at the time of purchase and introduction, they were likely either just exposed and not yet incubating, in early incubation with no visible signs, or in the preclinical infectious stage, already shedding virus from healing subclinical lesions before full lesion development was visible. Implication for purchasing protocols: a quarantine period of at least 14 to 21 days for all new small ruminants before introduction to the resident herd, long enough to allow most incubating infections to declare clinically. During quarantine, the new animals should be housed separately with separate equipment and personnel flow. Clinical examination before and after quarantine, with specific attention to lips, muzzle, udder, and coronary bands, would allow detection of active or healing ORF lesions before population-level exposure. Question 3. Epidemiologic triad and age disparity. The disproportionate impact on kids, 78 kids versus 42 does in a herd where kids likely represent fewer total animals, is best explained primarily through the host corner of the triad. Host factors. Kids are immunologically naive. They have no prior exposure to ORF virus and no acquired immunity. Does in an established herd may have prior natural exposure to ORF virus, which confers partial immunity that reduces susceptibility or severity of reinfection. Additionally, kids are nursing, which creates repeated microtrauma to lips and muzzle, port of entry, and direct contact with the doe's udder and teats, potential secondary lesion sites. Kids are also more likely to mouth fencing, feeders, and bedding, increasing fomite exposure. Agent factors may also contribute. Virus is highly infectious in naive hosts, and kids represent a completely naive subpopulation. Environment. The shared housing environment is the same for does and kids. This corner is less likely to explain the age disparity on its own, though crowding and shared equipment amplify transmission in both groups. Question 4. Dog's risk and concept illustrated. The 12-year-old dog is not at risk of ORF virus infection. ORF infects small ruminants and can infect humans, but dogs are not a susceptible host species for this pathogen. Parapox viruses have a narrow host range. Caprine and ovine species are the primary hosts, with cattle susceptible to bovine papular stomatitis, a related parapox virus, but carnivores, including dogs and cats, are not susceptible. This illustrates the susceptible host link in the chain of infection, specifically species susceptibility as a host factor in the epidemiologic triad. The chain of infection requires a susceptible host. The dog is not susceptible, so the chain is broken at that link regardless of exposure. It also illustrates that dead-end host and non-susceptible species are related but distinct concepts. A dead-end host can become infected but cannot transmit. A non-susceptible species cannot become infected at all.